Part of living well means taking care of your body so you don't get sick or injured.
Our next guest, Dave Asselin, is a doctor of physical therapy and runs PT 360 in Grand Rapids.
And he's here to talk with us today about their holistic physical therapy services. You're helping a lot of people, Dave. Can you just explain why people come to you?
People come to me because they're in pain or they have, they're not feeling well. It's usually something like in their hips, knees, shoulders, just any kind of chronic pain, any kind of discomfort that they have and that's been lagging or nagging for a while. And
yeah, athletes, people that are
middle
elderly,
age, our age.
Accidents maybe they've been in.
Correct, definitely post-surgical, car accidents, pregnancy and post-pregnancy, sports-related injuries. And what I really like working on is when people just get a pain that comes out of nowhere, where they just wake up one morning and their shoulder starts hurting and their hip starts hurting and they don't know where it came from. So it's very confusing to a lot of people.
Now, holistic physical therapy, is that really without medical intervention?
Yep, it's what I do is it's a lot more manual therapy, so it's all hands-on. So there's different types of therapy where I'm doing where I'm working 100% with my hands onto the people, and they're with the therapist for an hour at a time. The holistic part is basically resetting the muscles and the muscle balance that goes on with when muscles get tightened and fatigued. And our muscles basically go back and do it like contract on the microscopic level, do contract, relax, and when they get tightened up, they'll get, or when they get overused, they don't go limp, they'll go into a tightened position to try and help us out. And when that happens, it starts throwing off some balances within the muscles of how our hips and how our core is working. And normal physical therapy is really based off exercise and where they do want to strengthen. So when they test somebody out, they see weaknesses and they go, well, we need to do some strengthening for those muscles. And when I look at somebody and I see weaknesses, I don't look at that I don't see that it needs to be strengthened, but it needs to be reactivated. It needs to get turned back on.
Yeah. You know, I'm a person that works out a lot, and Dave, we're actually going to show some of the types of exercises you do. You brought in your table.
I did.
I took my shoes off.
That's right. That's why she's so much shorter here, because she's actually agreed to be the patient for today, which is so interesting because I look at Rachel and I think of somebody who's super strong, super healthy, but even in someone who works out, there are some issues that you can help correct.
Definitely. A lot of times with someone being active is they can start overusing a muscle, just like fatiguing a muscle. Like if you're going to run 5 miles and your body only has 3 miles in it, it can get, once it gets to that point where it can't keep up the workload, it's just going to give you everything it's got, and then it's going to tighten up, and these accumulate over time and over years, and then start shutting off other parts of the muscle, so you're not using 100% of the other muscles.
Right, or maybe you're using one side of your body more than the other.
Correct, as what a lot of times people see is Terry is just standing on her left leg, and she's getting off on the right side, and that could mean that she has more of an issue with her right side, so she doesn't want to use it, so she just naturally and doesn't even pay attention that she's favoring the other side.
So how would you figure this out, Dave?
So like when I'm looking at you, the first thing I'm looking at is just a little bit of your leg length, and I can see that you have a little bit of a longer left leg than you do right leg. So like even coming up and looking at your pelvis, I can see that your pelvis is rotated on that left side. So with muscle testing, a lot of things go with applied kinesiology. If your bones are out of alignment, then you're going to end up being strong, or end up being weak. So what we're going to do is just test out some strength and see what's going on. And what a lot of that's the pelvis rotation is coming from a spasm in your low back muscle, right back in here. So the muscle attached to the pelvis, when certain muscles are tight, it'll shut off others and cause neurological spasms and cause that rotation into that pelvis. So like what I'm just going to look at is a little bit of hip flexion, which is hold your legs right here. Don't let me push you down, fight against it. And so I put that as medium, because he's not locking in. And on this side as well, hold right there. And it's not locking in as well. Go ahead and relax. Bend your knees. Now, you do a lot of core workout, don't you?
Yes.
You do a lot with your stomach, so you...
With my stomach, and then, you know, kickboxing's my favorite, so upper body and legs.
Excellent. So let's just check out and see how your obliques are doing. So what I want you to do is cross your arms, come up into a little sit-up. And it's not about getting up there. I want you to lean back a little ways, rotate over here. I'm going to block you here. Don't let me pull your shoulder back. So you got some good strength on that side.
All right.
I'm going to switch over to this way. Now going over to this way. Hold right here. Don't let me pull you back.
Oh,
And you
much
see,
harder.
And you see how you have that difference between the two sides.
Sure.
Go ahead and flip over on your stomach for me.
Okay.
It's pretty common for people to have one side stronger than the other side.
Definitely, and a lot of times too is that's when it's not as involved. But as someone starts getting off that side, the injured side, is it starts overworking the other. So then we can have the same symptoms come up on the other side, but to a lesser effect because they just get overused. What I'm going to do is look at a little bit of her hip flexion. So we're going to look at her glutes and her glute max specifically. What I want you to do is go ahead and bend this leg and lift it up. Don't let me push you down. Good. So you got some good strength there. Bend this knee and lift this leg
I
up.
work that a lot.
And don't let me push you down. Hold it there again. You see how you don't have as much strength on that one too. So what I'm going to do is I'm actually going to work on your calf a little bit. And the reason that I'm going to work on your calf is because it turns into a little bit of a workhorse. Is when we're standing is, I would say, approximately 70% of our workload is coming from a little bit about the knees down.
Okay.
And so when you bend forward, it ends up causing the calves to activate, and they just get a lot of work, and they do a lot of workhorses. There's things in our body that are called stretch reflexes, and a simple stretch reflex is when, like a lot of people know, like when they go to the doctor and the doctor hits their knee or their patellar tendon, is that creates a little reflex where the quadriceps contract and you have that little knee jerk. And that's called a homonymous stretch reflex where it's singular. We have other stretch reflexes that are called heteronomous stretch reflexes, which are cause multiple things that go along. And so when those get tightened up, they start shutting off how other muscles start working and start decreasing your muscle activity.
Wow, that feels really good, Dave. Actually, I could stand for this for quite a while.
Well, you're working on that. Let's talk about, you have free consultations that are available for people to come and visit you.
I do.
Insurance will cover this with the doctor's prescription, and that's why you make the arrangement so that people can come in and really see whether they are in need of the services that you provide.
Correct, and see how it's going to affect them as well, and so they can kind of see how it's going to work and see if it's not. And there can be other things that go on, so it's not necessarily just this area. There's other things, nerve roots, adhesions, things along there. I got kind of a sore spot right here, don't I?
Yeah, definitely. I'm
So
feeling that.
again-
And Dave, I'm really impressed. You actually work with the Grand Rapids Ballet and a lot of athletes and different people. We're going to put all your information on our website so people can get in touch with you. Thanks for
All right.
coming in today.
Absolutely.
problem.
I think that I'm going to come see you too. My knee started hurting after I ran that 5K, and I'm thinking I've got some muscle things going on
So-
that are at the root of that.
Thanks a lot. We'll be right back.
Are you West?